Middle-aged men, what were some things that happened to your body in your 20s that made you say, that's probably nothing, but it was not? A sensitive left testicle which seemed slightly higher than the other one. Casually brought it up to the doctor when I was there to get a wart removed on my finger. The doctor handled my testicle. The doctor invited a student to handle my testicle. The student invited another student to handle my testicle. They sent me to get an ultrasound and she handled my testicle. A urologist handled my testicles. After much testicle handling, I found out I had testicular cancer. They took said testicle. 9 months later, cancer came back and I got chemotherapy. I'm 3 months cancer free. But moral of the story is, don't be afraid to let people handle your testicles if something doesn't seem right. My right balls started hurting. Doctor told me it was probably from ibuprofen. Years later, after it never went away entirely and got a lot worse, I found out I had a hernia. I was probably the happiest hernia patient in the world, because I had myself convinced it was something way worse. Take care of your back. You will not listen to this, but you should. One day you will do something mundane in a slightly awkward position that shouldn't normally be any problem and it will feel like someone snuck up behind you and blasted you with a shotgun. I thought I was finally getting that butterfly in your stomach feeling every once in a while. But it was just my heart deciding to beat how it wants, not how it should. The heart wants what the heart wants. Butthole started hurting at age 24. Figured it was just a stubborn hemorrhoid. Got worse over the course of a year. One day I took a crap and had to go lay down for 20 minutes to recover from the pain. Decided to immediately go to urgent care after. Diagnosis: perianal Crohn's disease. My friends always joke I'm an butthole, but now I'm a rotten butthole. Mine was late 20s. Caught a sinus infection after sucking some smoke while working a commercial fire. Well, sinus infection? PFFT, please. Yeah, well, that turned to pneumonia and the pneumonia turned to Guillain-Barré, very rare form, and transverse myelitis. Suffice it to say, I'm writing this from my power wheelchair since I don't even have enough function to push myself around. From AFing sinus infection. I wish me in my 20s would have listened when everyone said to rest with the pneumonia instead of still doing normal crap. Med student here. Just so you know, your GBS probably had nothing to do with you not resting while you had your sinus infection pneumonia. More an issue of you catching the wrong bug to begin with and your immune system having the wrong reaction to it. In other words, please do not blame yourself. I'm going to take your question literally. I realized a bunch of hair falling out. So I thought, this is it, I'm going bald. There's going to be probably nothing left. But it stopped. I have less hair now, but I'm not bald. You just gave about 50% of us hope. LOL. My insomnia got dramatically worse and periods of low energy became periods of no energy and numbness. I figured it was lack of sleep. After all, every so often I'd just stop feeling so crappy for ages, weeks, months sometimes, and get metric frick tons of stuff done. So it wasn't like I was depressed or anything, was it? Well, no. A decade of misdiagnoses later, turns out to be bipolar 2. I'm finally getting slightly better with the help of mood stabilizers, but still very much not right. In my late 20s I went through a time when I had to use the restroom more often than what I thought was usual. When we would go to unfamiliar places, long car rides, etc. I would have to stop at every rest stop to pee, regardless of how much time has passed. I have anxiety, diagnosed, and drink coffee and alcohol, so I had partly chalked it up to those and would just try to talk myself out of the anxiety part. When I was 29 I finally opened up to my PCP about what was going on. He ran some tests and found I had low-grade BPH. Benign prostatic hyperplasia, something quite common in men over 50, but not in their early 30s. My doctor's take was that it was really early for this to be happening, but not unheard of. He put me on anxiety meds and told me to minimize or cut out both alcohol and caffeine. He said that the drugs that you see advertised on TV and such for men with prostate issues are taken for life to manage, and he didn't want me to start a lifetime plan so young. Now when I have things to do that require trips, business conferences, vacations, etc., I change what I consume for days prior in order to manage. In retrospect, I appreciate being forced to recognize what was happening because With so many medical things, people find out too late to make meaningful changes. Well, I wasn't really symptomatic, but I wish I could tell 20-year-old me to stop eating like crap because 42-year-old me has high cholesterol and diabetes. Served in the army during Iraq. Patrolled with a high-powered jamming radio antenna next to my head. The warning label said to stay clear, but the army was like, sure, install it next to the gunner's head. That seemed like that's probably nothing. Heck, in perspective, we were issued asbestos gloves to change hot gun barrels that fired too many depleted uranium rounds. What's a radio gonna do to me? Well, years go by. A VA doctor finds an extremely rare skull tumor the size of a ping pong ball growing right where the warning label sat. Sounds like you might be entitled to some money. Get your suing shoes on. Look after your back, your knees, your lungs and your skin. Eat less crap. Do more exercise. Sleep regularly. Or, live fast. Die young and leave a fricked up corpse. You're cool. Adding drink water because kidney stones are probably one of my biggest fears. I was often so tired that I would fall asleep standing up, in the shower, etc. Over a decade later I was diagnosed with Hashimoto's thyroiditis. I have that crap too. From 16 onwards I gradually got more and more tired. Even on thyroxine I still never feel 100%. My immune system is a joke. I'm not even 30, but that totally normal back pain turned out to be a herniated disc pressing on the nerves in my spine, which spread to my leg eventually. Now I need surgery, and I've been in pain for months, and unable to work. Tearing my ACL. Just figured I would have surgery and go on with life. I didn't realize I would essentially never have the ability for the remainder of my life to play any sport that did not involve straight line running. Or if I did, I would have to wear a horrible, bulky knee brace. That I would never be able to sit cross-legged again, or just that generally if I bent my knee too much with my weight of 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 my weight. I got surgery 7 years ago, and after 6 months of physiotherapy I was able to do everything. And at 34 I'm still doing it. I play soccer, jog and snowboard in winter without problems. Acquired special ability, predict rain. Carrying 80 pounds of photo gear in my rucksack, was shooting from one knee. When I went to stand, my knee did something that felt vaguely like somebody breaking celery in half. I was so amped up I didn't feel any pain. Figured it's nothing. Narrator, it wasn't nothing. Yes, for the love of God protect your knees because you are going to pay for not doing that for the rest of your life. That numbness in my leg is no big deal, it comes and goes. It was a big deal. In a wheelchair for years now with multiple sclerosis. I had a little bump on my cheek that didn't go away. Not a mole. It was normal flesh toned. Dermatologists always talk about discoloration and such, so I just ignored it. Like 10 years later the thing would just start bleeding for no reason, which concerned me enough that I finally went to a dermatologist just to get it checked out. Turned out to be cancer. I had to have a good bit of tissue removed from my cheek and a plastic surgeon did the closure so there would be less of a scar. If you have a weird skin thing, get it checked out. Freaks out about all the weird skin things I have. As a hypochondriac I have no business being in this thread. Don't be young and foolish with your ears. Use noise protection. There is no shame in using earplugs at auto races, concerts, when using loud work equipment, etc. I have earplugs for concerts and I have to say I enjoy using them more than not having them in. It reduces the pressure on my ears and I can listen to the music clearly. Especially for bands that really crank it, I don't have to worry about ears ringing the next day. Absolutely worth the money. A little while ago I had a little bump right above my crack. Thought nothing of it. It got bigger and started to hurt. Turns out it was a sinus pilonidolus. Pretty nasty. Google at own risk. I started getting weird cramps at 27 in my calves. Also, lots of knots in my thighs. At 29, my left piriformis and hip flexor locked up. I've been crippled for 2.5 years and they are just now healing. Cause? I had learned to walk wrong and nobody noticed. It caused structural failures in my hamstrings that then put strain on my hip flexor. Sitting down is painful and laying down is uncomfortable. Lower back pain. Turns out if you take Motrin every single day for years you can cause some serious intestinal issues. Also by masking the problem with pain relief medication instead of focusing on core exercises like yoga or Pilates while working out. I only let myself exasperate the issue more until it was too late, and now I have several herniated discs. I did professional marching band in my teens and early 20s. 10 years of dedicating 10 hours a day, practicing difficult and highly athletic shows in the hot summer sun. Thing is, we didn't know enough to worry about being in the sun for that long at that young an age without sunscreen. Cut to 10 years later, and 2 strange freckles appeared on my forehead and 1 on my shoulder. Migraines. Never had them before. Ended up being a tumor. Listen to your body. And knee problems. Grew up playing every sport under the sun basically. I think it was being a goalie, hockey, that did me in though. Either strengthen your knees or just take it easy on them or you'll end up doing some damage. A lot of people tend to go from active to sedentary at some point in their 20s. Once you do that you can't just pick up where you left off, unfortunately. Pro tip: if you're going to get migraines, you've usually had your first one before your mid-20s. If you get one after that it's a red flag. Not middle-aged, but just turned 26. Something that I've played it off as getting old but turned out to be a real problem was my sex drive. I was gaining weight, always tired, and my sex drive plummeted. I kept blaming it all on stress and long hours from finishing school and starting my career. But my fiancée got to a breaking point when we haven't had sex in quite a while and I kept turning her down because I wasn't in the mood. I was tired, or I had a stressful day were my excuses and they were legitimate. She finally told me to get checked out just to make sure nothing is wrong. I went to a male clinic to get my testosterone tested for $50. Turns out I was barely producing testosterone. 300, 1000, whatever units it was, is the normal testosterone level for males, with 300 being an old man and 1000 being a teenager. My age, I was supposed to be around 700. They tested me twice and both hovered around 80-90, way below the threshold. Immediately went to an endocrinologist. She suspected a brain tumor, almost always benign, on the pituitary in my brain that's basically feeding off the testosterone and preventing my body from receiving any of it. Luckily it's easily treatable and the most common of brain tumors according to her. These are usually taken care of with medicine, no chemo or radiation, and if it's really necessary, surgery. But they go in through the nostrils and remove it, so no open brain surgery or anything complicated. But actually after an MRI, there was no tumor to her surprise, and said I had a really rare case where my pituitary has just gone to sleep and stopped working. I'm currently on a medicine that tells my pituitary to produce testosterone naturally and everything is good. Last blood test was a few weeks ago and my testosterone levels were at 280 and rising. We're going to be upping the dosage soon and then cutting out the medicine altogether to see if my pituitary has woke up. All in all, I wanted to share, because if you're in your 20s and you feel like you have the sex drive of a 70-year-old man, get your testosterone tested, and side note, if it's low don't do testosterone therapy. You'll get immediate results but you'll become infertile within a few days and the issue could be bigger than just needing testosterone shots. See a specialist and talk about treatment options. Depression, anxiety and sleep disorders. Blew them off in my 20s thinking they were no big deal and that everyone has their quirks. Waited way too long to get help out of fear. I didn't want to be medicated. I didn't want to turn into someone else. As bad as those things were, I thought it's probably nothing. Just cost me my marriage. Getting help now, but it's very much a Pyrrhic victory. I had the hardest time persuading myself to go on medication, even when I was experiencing day after day of severe anxiety. Glad I finally sat down with a psychiatrist and got things sorted out. Dislocated my shoulder in wrestling more than a few times in my younger years with only a month of recovery. Then in university I popped it again and couldn't do crap for months. I can't put my elbow above my shoulder without some chance of it coming out. Learned this the hard way when I was playing with my sons and it came out when I was holding him in the air. Pretty painful and sure the frick wasn't going to drop my boy. In my mid-20s I noticed one of my testicles was firmer than the other. Not bigger, just denser. It didn't hurt. I was busy and invincible. It was actually blindingly powerful lower back pain that sent me to the air. When I got to see a doctor I'm pretty sure he knew in 5 seconds what was happening. It was cancer. And chemotherapy sucks, but it beats the alternative. I'd randomly go fully deaf in my right ear sometimes. Not like muffled, but suddenly overnight complete deafness. It had come back a week or 2 later. One time it came back with tinnitus, so I went and begged them to check me out. Brain tumor bye. At 26 or 27, some 3 or so years ago, I smacked my foot on the tatami at an odd angle whilst demonstrating how to throw yourself really far forwards when falling in order to get the kids I was teaching to put a lot of energy into their fall. Training. Stung a bit. Felt like a pulled tendon or a sprained ankle. Didn't heal for 4 months. Went to a physiotherapist for it, suspecting it was an injured tendon. Didn't heal over 6 months of physiotherapy. Didn't heal over summer. Physiotherapist gave up, saying that maybe it was an injured tendon. I told you so. Took a year to see an expert. He squeezed and pulled and pushed and bent on my foot for about 5 minutes. Said it's either the tendon or the joint itself that has been damaged and immediately booked an MRI. Took a long time to wait for it, but I'm finally getting the MRI in a week, and then we'll decide if we should operate, inject or leave it. It flares up, and when it does it's bad, but goes away. The foot is somewhat less mobile than my left, and when moving it in circles I can feel the tendon skip and feeling gravely extra crunchy, but I am generally fine for the most part. So operation might be a bit too extreme at this early in my life. I just turned 30, but at least we'll know if it turns worse over the decades. But yeah, now, oh well, it's probably nothing. See you next week. Still have problems 3 years later. In high school I was going down the stairs and tripped, but kept a hold of the railing. Felt my arm shoot up while my body went down. After I regained my balance my arm felt like dead weight and I couldn't move it at all for a while. Finally back to normal, but now my arm sort of shifts and locks into place. I can feel it grind or make weird noises sometimes. Still gotta go get that checked out. I thought that everyone thought about death and suicide daily. That slowly got worse and more frequent. Then one day I woke up scared out of my mind, crying for no reason. Turns out I have anxiety and depression. Therapy and medication have helped a lot. The descent into depression is such a shallow slope you can go forever without realizing how far you've sunken. Felt tired as crap for a couple of years. Depressed. Had stomach and bowel issues. Thought it was stress from work. Almost switched careers and quit my job because of it, but when I started pooping blood I thought it might be a good idea to visit a doctor. Turned out my vitamin B12 was way below the threshold caused by an intrinsic factor deficiency. Other words, my body doesn't absorb vitamin B12 as a normal person. So when you feel crappy for a long time, please just go to a doctor and let them check your blood. Not 20s, but 30s. Started losing weight gradually. Mood got worse. Anger management control went down. Pain in toes. Bit more thirsty. I was also eating loads but not keeping weight on. Each bit, on its own, I ruled out until I was concerned about my mental health. Turns out I am a type 2 diabetic. Found out 5 weeks ago. Feel much better now I'm on the right medicines. I'm about to turn 40. Boxed in my youth. Would suffer concussion semi-regularly. Torn muscles, etc. Not good today. Something always hurts or doesn't work as well as it should. Martial arts, judo, MMA, BJJ, and motorcycle accident. Broken ankles, collarbone, femur, pelvis, forearm, body. Saying hi. Broken is the word. I feel your pain. Me in my 20s. Oh, this heartburn isn't anything. Me in my 30s. Oh boy, now I get to take prescription meds for my acid reflux so I don't wake up in the middle of the night and puke my guts out. Did a lot of stupid things in my 20s. Age 41, went to the doctor for a pain in my hip and leg. Doctor looked at my x-rays and MRI and asked me when I broke my hip. I was a blackout drinker in my 20s and often woke up with injuries I had no clue how I had sustained. Apparently I broke my hip in 2 different spots and now I have early onset arthritis. Woke up with what felt like a mild sinus headache. Kept getting worse. Vision started getting blurry. Went to hospital. They said IDK and sent me to eye specialist. By then my left eye was just a giant blur and hurt to look around. It was optic neuritis. This turned out to be a symptom of MES. I was officially diagnosed with RRMS in 2016. My dad was diagnosed with this after 10 years of trying to figure out why the heck his left arm kept going numb. It's a crappy card to be handed. The bipolar diagnosis 5 years later didn't help either. I hope you're doing okay though. One side of my lower rib went missing. I thought it was nothing much. After an x-ray I found out that when I fell from a tree as a child, my ribs bent to my right more than left, so it make me feel like I'm losing one rib. After being constipated for a few days I was finally able to void my bowels and man did it hurt. When I went to wipe there was a lot of blood, which made sense because I could feel my butt tearing as I pooped so I didn't think anything of it. A week or two of regular bowel movements later without blood and I had forgotten about until after a normal movement and the bowl was filled with blood. Went straight to the hospital. Turns out it was cancer. If you ever bleed from your butthole go see a doctor. I woke up one day and my back was a bit stiff. That's odd. Must have slept on it funny. It will go away. Nope. Back sore stiff all the time now. Cool. I thought I had gotten a pimple at the top of my butt crack. Figured it would go away after a couple of days. It did not. It became huge and extremely painful. It was an ingrown hair that caused a pilondial abscess. It was the most painful thing I have ever experienced in my life. At the 3-4 day mark I was beginning to become delirious with pain. At 2-3 am after not sleeping for about 2 days I somehow managed to drive myself to the hospital. The triage nurse asks about my pain and I sheepishly say 7/10. I feel guilty for going to the ER for this. Nurse offers me Tylenol for the pain. I decline. Eventually I get called into a waiting room after a 2-3 hours wait. A doctor checks me. Asks what I am taking for the pain. I say nothing. He tells me I have to take some Tramadol right away. After a couple more hours of wait the doctor finally had time to do the minor surgery to drain and clean the abscess. He shows me the amount of pus that came out. It looks like the sac had probably grown to about the size of my entire thumb. Disgusting. I then had to lay on my stomach for about 1.52 weeks as the wound healed. They pack it with medical tape so that it would heal from the inside out, ideally preventing reinfection. I have been lucky and seem to have avoided that. My warning to you younger guys is to never trust that a pimple near your tailbone butt crack is actually a pimple, especially if you are a rather hairy guy, and double so if you have an office job and sit a lot. That area is infamous for ingrown hairs that cause these pilondial cysts abscesses. It was the worst pain I have ever felt in my life. A sore neck. Turns out my spine is slowly disintegrating. I've had several surgeries now, and 2 vertebrae fused. Looking forward to more operations in the future. 30-year-old single man here. At 25 I felt my hormones settle down, and with that natural change I assumed I was in for normal aging changes. I was wrong. I started feeling aches and pains around 27, mostly in my sides that I attributed to normal getting older. I also began having irregular and messy bowel movements. By 28 I had become an expert at holding my bowels until I was home because there was a good chance I would need to shower after with how messy it was. I knew my diet was poor, and I was eating fast food nearly every meal so it all made sense that I might not feel great. Then circumstances of life forced me to move in with my sister, and all of a sudden my diet was vastly improved since she refused to let me eat fast food all the time. Time with family and less depression saw me eating very healthy, but the pain continued. It was actually getting worse and spread to my entire midsection. I should add that I'm poorer and live in the US, so no medical insurance for me, otherwise I'd have seen a doc. Anywho, my bowel movements are where I really began to notice a difference as they were becoming a bit more regular and less messy. My first real improvement. I began passing a lot of gas for a few months into 29, and my stool was hardening. I personally still felt ill but it wasn't enough to be distressing until late 29. I began feeling severe pains in my lower back and my bowel movements were awful again. My 30th birthday came, And that weekend, while enjoying myself at home, I felt a serious bowel movement coming. I sat down on the toilet and let out so much flatulence that I could see my belly change shape. Then I pooped. A lot. It kept slithering out and pulled in the bottom of the toilet. Grey and bland. It looked like there was nothing to this feces. Like my body had absorbed every nutrient from it long ago. What really caught my attention was a long strand of paper wrapped up in the feces and stark white. That's when I remembered. A few years prior I had eaten a receipt from Lowe's, which my business partner had wanted to see. Being a cheeky bastard, I ate it, and I believe inadvertently allowed a receipt paper to get caked up in my bowels, making me sick for the better part of the past half decade. A few months later now and I feel amazing. Better than in years. I'm having trouble believing that some paper survived your stomach acid and then survived sitting in your intestine for years. But I've never been to Lowe's, so maybe they have fricked up receipts. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.